come closer. Yes, come closer. Let me tell you something. You are sexually active, and when you have an infection, the next thing that comes to your mind is that this is a sexually transmitted infection. Do you know that there is something called urinary tract infection, UTI? These infections are not sexually transmitted. Yes. So it's not itching or burning sensation that are sexually transmitted infection. And for the young fellows on my DM that talk about the fact that they are not sexually active, but they experience inching down there, they experience some burning sensation, and they are worried, what could that be? That could be a urinary tract infection. Yes. So I'm going to be enlightening you today about the 6 signs of UTI that you should take note of. Good day, everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Mercy Mary, popularly known as the Nurse with a Difference, and I make learning easy and accessible for all my viewers. Today, I'm going to be sharing with you 6 signs of urinary tract infection, so you stay informed and not misinformed. But before we go into details into this class, if you are new on our YouTube channel and these are content you are interested in, please click on that subscribe button. Turn on that notification bell so you don't miss out. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Let's go there. All right, welcome back. Let's go straight into the point. What do I mean by UTI, urinary tract infection? It simply means an infection of the urinary tract. For those that don't know what urinary tract is, let me explain. The urinary tract includes your ureter. Are you seeing that 2 tubes? Yes. Your bladder, where urine is being stored, and your urethra, where urine comes out through. As a human being, your body makes urine. Your kidney is doing its job, is making urine. Then the urine gathers through that urine, comes through the ureter, it goes to the bladder. It keeps going. It's just like a cup. Put the water. So when the cup is now red, is now full, like, oh, I'm full. It sends message to the brain for this cup, that's the bladder, to release the urine through the urethra, and you pass urine. So that's it. That's the simplest explanation I am going to give. So any infection of this urinary tract that you can see, the bladder, the urethra, the ureter, that is a urinary tract infection. Okay, so I'm going to be sharing with you 6 signs of this urinary tract infection. The first one I have to share with you is frequency and urgency. What do I mean by that? If you have urinary tract infection, there's this urge to go and pee. Frequently, you are visiting the toilet as if you have diabetes. But unfortunately or fortunately, you don't have diabetes. You are just having a UTI. So this frequency and urgency is as a result of an inflamed bladder. You know, when there's an infection, the bladder is swollen. So when the bladder is swollen, it is inflamed. There's going to be an irritation. You know when something is irritating you now. So because the bladder is irritated, the bladder is also quickly sending message to the brain, I need to pee, I need to pee. So there's this frequency and urgency to pee when you have a urinary tract infection. Now that takes me to the second sign I want to share with you. Then the second one is what we call dysuria. Calm down. I'm going to be explaining what dysuria is. Dysuria is simply a burning or stinging sensation when you want to pee. You say when you want to pee, like it's burning, it's stinging. Why does that really happen when you have UTI? This happens because there's an inflammation of the urethra. You see that small pipe where the urine comes out. So it's swollen. It's going to be irritated by the urine coming out. So that is why when you want to pee and you have UTI, you're going to be having this burning and stinging sensation. And when that happens, you see yourself, oh, you pee, you stop because it's kind of painful. It's burning you. You know when something is burning you? That could be a sign of UTI. Burning and stinging sensation during urination. Then that takes me to the third point I want to share with you. Then the third one I want to share with you is hematuria. What does that mean? Calm down. Let's forget about the big English. Hematuria simply means blood in the urine. Yes, if you have UTI, you can see blood in the urine. The infection can really be severe in such a way that there is a bleeding in the bladder that comes out alongside with the urine. That takes me to the fourth sign I want to share with you. The fourth sign is suprapubic discomfort. That is, there is a lower abdominal pain. Like, this is your abdomen, right? The lower part around the pelvis. You'll be experiencing some pain, some difficulty around that area. So lower abdominal pain could be a sign of UTI. That takes me to the fifth point. The fifth point I have to share with you is cloudy and offensive urine. Yes, offensive smell urine. So in terms of the cloudy urine, this could be as a result of the white blood cells of the pus, of the infected bladder cells floating in the urine. We all know that when we have infection, or for those that don't know, there's an increase in the white blood cells. So these white blood cells could be floating in the urine that results in that cloudy urine you see when you have UTI. And the offensive smell is as a result of certain bacteria breaking down the chemical products, the chemical compound in the urine, and the byproduct it releases causes that offensive smell you experience when you have UTI. So that takes me to the last point which I want to share with you. The last point I want to share with you is lower back pain. Yes, because pain from your bladder can be felt in other parts of the body that share the same spinal nerve supply. So you have lower back pain. So it's not just the lower abdominal pain, but also lower back pain. So these are the 6 signs of UTI that I said I should come here and share with you. And I hope this is beneficial. This video was actually prompted by a video Dr. Simi Adedeji made. Thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Simi saying thank you. Bye and see you in my next video.